So good afternoon, everyone. I'm Faith Berland from Valid Entry, and we're thrilled to be here. Thank you, Samara and ACA for having us today. I think it's critical that our children get back to camp this summer. I have 3 children of my own who are living 10 for 2 and really can't wait to get back. One of my daughters went to one of those 4 camps that did open in Maine last summer that Boris highlighted, and it was really an exceptional experience. So we hope to help other camps replicate that same experience. So Valid Entry has partnered with Labcorp and Access Bio to create a safe camp monitoring system and really take the administrative burden off of the camp. So we will set up each camper and staff in our system and get all of that information to Labcorp so that Labcorp can send at-home PCR tests to each camper and staff the week before they're planning to arrive at camp. Valid Entry will then monitor the progress of those tests, make sure those tests are received back, and that they're taken, that they're received back, and that the results are negative, and that all occurs within 72 hours of when the campers are to arrive at camp. And that will all be reported through our online dashboard to the camp and the camp community. So I think that's really critical, and I know that some others have highlighted the importance of PCR, but the importance of a dedicated PCR test that has the volume and the guaranteed turnaround time will be critical. I don't know if many of you recall, but last June we ran into a real big problem when some camps just were opening, and that last week of June test results were not coming back in a timely fashion. Causing a lot of stress for parents and camps. So then once the campers do arrive on camp, whether they're taking the bus or being dropped off by their parents or taking a plane, we recommend a rapid antigen test. And we've partnered with Access Bio for their Care Start rapid antigen test. The antigen test is super easy to administer. It's a nasal swab, and the results are available in 10 minutes. Again, those results get reported right into Valid Entry's monitoring system and are disseminated to the camp real time, as well as the broader camp community, so parents and staff. So in summary, Valid Entry has taken the administrative burden off of camps with best-in-class monitoring, taking the stress off of parents with best-in-class PCR and rapid antigen testing, and has a cost-effective end-to-end solution. We're presenting pricing here without insurance, but obviously we can speak to the insurance pricing as well. I'd now like to turn it over to my partner at Labcorp, Matt Christensen. Matt.
Yeah, I'm here. Thanks, everybody. Yeah, so Labcorp has partnered with Valid Entry, and I'll just kind of give a little bit of background on Labcorp and then go through our at-home PCR test. So PCR is the gold standard. So that's what we'll be presenting today for our Labcorp at-home solution. So this is for children under 18, and Labcorp was the first laboratory back in March of 2020 to get PCR EUA authorization from the FDA. So we've been running these tests for quite some time. To date, we've done around 41 million tests, and we're currently doing 275,000 tests a day. So that's our capacity. So we have adequate capacity, and there should be no issue with getting that turnaround time or getting that test back within 24 hours. So here's the process of Labcorp at home. So the camp would send all the campers' names and addresses and email addresses to Valid Entry, and then we would place an order for that camp on a specific agreed upon date. And then we would overnight the at-home kit shipped directly to the camper for testing. They would also receive an email to the parent's email address that says that their kit is on its way. And then that parent slash camper would self-collect using nasal anterior swab. And then they would return that to LabCorp in Raritan, New Jersey, which is central New Jersey, and we give them a pre-addressed, prepaid FedEx envelope. So it's sent overnight directly to our laboratory for testing. We would result it within 24 hours, and that result goes directly into the valid entry portal, which all the camps can utilize. And then also is the results. We have an app. It's called LabCorp Patient, where the parents can log in and also see their results as well. So that's the process and overview. And here's just a quick picture of what an email will look like. So the parents will get an email with a FedEx tracking number, say that their kit is on the way. And then there's also a video in the email they can click that shows them how to self-collect as well. So it's a very easy process. And then here's just what a kit looks like, an at-home kit. So we give them adequate instructions on how to do this, and everything is in there, the FedEx return label, the swab and everything. So it's very easy process. I've done it multiple times. We've had numerous children under 18 do this with very ease and no issues.
Great. Thank you. So now we'd like to turn it over to Dr. Jesse Sandhu at AT Health to discuss the Access Bio Care Start Rapid Antigen Test.
Hi guys, Jesse Sandhu. Can you guys hear me?
Yes.
Okay, great. I am, my credentials real quick. I'll try to make this as fast as possible because I know time is limited. I'm a dual major in molecular biology and dual degree in molecular biology and chemistry from the University of Michigan. I did my honors thesis in virology. I've studied about 7 decades of coronavirus, and I'm a board certified emergency room physician. Currently own my own freestanding emergency room in Steamboat Springs, Colorado. And based on my background, I've been testing as early as you could have possibly tested in this pandemic in early March. So I'm very familiar with all of the testing modalities, their sensitivities, their specificities, all their limitations. And my company, AT Health, I'm the chief medical officer of, which we formed back when the pandemic started. And we've partnered strategically with Access Bio through their master distributor, Intrivo, which I serve as chief medical officer of as well. So we have been consulted because we are a solutions company. So we're not just consulted about testing, but we're consulted about how to employ testing. There's certain people that need testing. For instance, if you look at the highest level, you'll see like the NFL, like sports agencies. They have an unlimited budget. And when you have an unlimited budget, you can do very, very good testing. You can have your own dedicated high complexity CLIA lab and do PCR, expensive PCR testing, which is the gold standard. But ultimately, you're going to run into a lot of constraints when you try to trickle that down to a campsite, because you have geographic issues, you have personnel issues, you have cost issues. And so unfortunately, not everyone can be the NFL. And so that's why we're a solutions company. We look at your individual camp and we figure out what you guys need, what works within your budgets, what works within your personnel constraints. And that's why we're happy to partner with Valid Entry. And so you will have that expertise. We've consulted for small minor league hockey teams. We've consulted for universities like Florida State University, Sacramento Kings, the New York Mets. So we kind of know, based on what your needs are, even office buildings, what your needs are, and we can come in and help you out. I like the antigen test model hybrid with LabCorp's PCR model. I think that the best advantage you have as a camp is you are essentially a bubble. So as long as you regulate what's going in and what's going out of that bubble, you really just have to do some minor tweaks to make sure that everything inside the bubble remains safe. And that's why I like antigen tests, because you don't take the specimen out of the bubble. You don't need a lab. Your lab is essentially inside the bubble. And so basically we screen everybody, quarantine everybody, like everyone was saying before, and we use our LabCorp PCR to screen everybody 72 hours before they come into the bubble. Once they enter the bubble, obviously we're going to have our questionnaires and our temperature checks. We're going to do that daily. And that's all going to be through the Valid Entry portal. And then we're going to do a series of antigen tests. Now, we all know antigen tests aren't as sensitive as PCRs. They're very sensitive with high viral loads, which I think the rapidtest.org, I forgot your name, I'm sorry, the physician was very clear about. They're very sensitive at high viral loads, but you lose that sensitivity in low viral loads. The caveat here is that at low viral loads, people aren't infectious. Usually once it gets up to that higher viral load, that's when they're infectious. Secondly, if you actually combine antigen tests in a batch, in other words, you do day 1, day 3, day 5, you significantly increase that sensitivity. And that's how Abbott's able to get to those numbers. Those numbers are actually not, if you read the fine print, it actually says symptomatic patients within the first 5 days of COVID test whose doctor suspects COVID. That's actually a very, very kind of vague term. But what they've done is essentially said they've taken people and they batch tests in symptomatic patients, and that's how they get that sensitivity. We're not trying to sugarcoat sensitivities. We know the antigen test has limitations, but we've minimized those limitations by doing multiple tests. It's very hard to get 2 false negatives out of the same patient within a 3-day span. And so that's kind of I think what works real well in the campsite setting is to just have rapid tests resulted in 10 minutes, and you have the ability to know and take that person out of the contact chain, and you don't have to wait 12 hours for your PCR or 24 hours for your PCR. Within that time, someone could have infected, several people. So I like the antigen model. It's very cost effective. With our relationships with Access Bio's CareStart antigen, we can get that cost very, very low and out to those camps. And so from a monetary standpoint, it's really, really a good system, and it's worked really well in other settings. So that's really
great.
what I want.
Sorry to cut you off. We're just hit our 10 minutes. I know we could all talk forever. So that was awesome. Thank you so much. Faith, did you have anything to wrap up, or that's good?
That was it.
Awesome. Great. So this is awesome. Left us 10 minutes for some Q&A. I do have to, if you just want to unshare your screen, Faith, so that everyone can see everybody, that would be great. So since we have so many people on, usually we only have 1 or 2 subject matter experts. We have 8 plus all of their extras. I'm going to kind of have people raise their hands or feel free to unmute yourself and say yes or no. I think it's a perfect segue. Dr. Sandhu was just talking about bubbles. That is possible for sleepaway camps, but not for day camps. And we have plenty of day camps on here. So Dana had a specific question about how do you all feel about testing day campers prior to coming into camp because they're going home every night anyway? Is it necessary to start off with like a negative camp slate, or are we really testing kind of symptomatically at day camps? Yeah, Phoebe, I know you raised your hands. Happy to have you start off. And then
yeah, so I would sort of view the day camps similar to how we're viewing school-based testing, which ideally we look to do a weekly testing regimen for in-school testing. And I definitely think that testing of day camps is actually probably even more important, because the kids are going back home, even if they're going home to vaccinated parents. There is, breakthrough transmission. If children become infected, they can potentially infect others. So I think the fact that it's open means testing is actually even more important, and a weekly testing regimen would be ideal.
Great. Did anyone have anything to add? Or yeah, Kathy.
So the pool testing is a great option for the day scenario. I had said that I don't recommend the pool testing for the sleepaway camps, because you have one shot to get it right. It's a really big deal for the family. It's a burden for the family to get back and forth. We do offer pool testing. We do it with a ton of schools, and it is a great option. It is very cost-effective option. And for the child, when it means you might stay home for a day or 2 and it's not the burden to the family, I absolutely would agree with the pool testing in that scenario.
Great. Did anyone have anything else specific for day camps? Okay. Lori was being so cognizant of, Lori was being, from Educator Research, being so cognizant of time that she forgot to say her pricing. So she put it in the chat, but I'll also just say the daily checker starts at $10 per, I assume, per camper, and the antigen testing begins at $20. Can someone speak to, I'm gonna like pull a name out of a hat, because I feel like that's the only fair, how pool testing works? Yeah, Boris, please.
Sure. Yeah. So pool testing has been around for quite a long time. Obviously, everything in the time of COVID is new. So pool testing for COVID has really started to become operationalized in scale in the late fall. And now it's really being rolled out as one of the good ways that you can test more people at a lower cost This is being done through, again, in Massachusetts with the program that we're working on, and this is being looked at as a model that could be scaled across the nation. Specifically, pool testing really has two approaches. One is you do the pooling on site. So you're collecting the samples, you're pooling them on site, you're sending those to the lab, you get one result. This is really effective when you have low prevalence. Again, that's the case in schools, and it's expected to be the case in camps. If you do get if it's negative, everyone's presumed to be negative. If that pool test is positive, it means at least one person in that pool is likely to be positive, and you then want to retest all those individuals. There's a few different strategies how you can do that. One idea is to use the rapid antigen tests. In almost all cases, one of the thinkings is that you want to follow up any antigen test, a positive antigen test, with a confirmatory PCR test. The other strategy around pool testing is the pooling can be done at the lab. So you're just taking a single test, you're sending it into the lab then pools those samples and delivers individual results in those cases. As you can imagine, if you're doing the pooling at the source, it's going to be cheaper versus the pooling at the lab. So that's real quick answer on pool testing.
Oh, that was helpful. Thank you. Emily, let us know if that helped. I think that we all, us laymen's here, who have tried to educate ourselves as much as possible so that we can run safe and successful camps, but there's a lot of noise around false positives for rapid tests. Can anyone speak to what kind of where we're at with that in April of 2021 and any data behind it? Because they kind of have scared folks that if you rapid test someone that is not showing a symptom. I know what Phoebe said spoke home to me, which was it's testing for a virus, and if virus is there, it doesn't matter if you have a stuffy nose or have lost your sense of smell, the virus is there. But does anyone speak to the actual percentages or data behind that? Yeah, Kathy, sure.
How to get my unmute. Well, we can, as laymen, we can look at this and try to understand the medical data on this. I always try to simplify this for people. So the false positive or the false negative information is provided with each of these kinds of tests. So if you have an antigen test where it says that it's, as my example was, if it's 90% specificity or the sensitivity, if one piece of it leaves 10 out of 100 times that you do that test, that you don't actually know if it's a real positive or a real negative. There are environments where that isn't such a terrible thing. As I said, with the day camp example, when a child can go home and kind of wait it out and get that secondary test, sometimes an antigen test would be fine, but in an overnight situation with the burden for the family, you need to know, 99% of the time that you're going to have the right answer on that test. So rather than trying to analyze and figure out what these percentages means, I think it helps to put it in real numbers, that if it says that it's 90% effective, then there are 10 unknowns walking around on your camp.
And I want Owen, if you don't mind unmuting yourself or putting in the chat, are you asking from the perspective of using it instead of PCR, or are you asking because if someone comes down with a fever at camp, the first step you want to know is if they have a negative within 10 minutes or if they have a positive within 10 minutes for quarantine purposes? Because I think that's what you're getting at, but I don't want to put words in your mouth.
Yeah, well, I mean, there's a number of ramifications, but specifically, if we do rapid testing for everybody on arrival, so let's say we have 100 campers who are coming on arrival and we rapid test all of them, how many of those generally are, may have a false positive. So, they're going to come back positive, but they're not actually positive. So then we're sending a parent, back 3 hours home.
Yeah, I think Brian, raising your hand.
Actually, oh.
Yeah, go ahead.
It's not the false positives that we're most worried about. I think everybody is saying if you're coming like the viral load, if you're at that point and showing positive, the numbers are pretty conclusive that you're seeing accurate. It's more the false negatives. It's asymptomatic people who may be in earlier stages that their viral load is not quite there, that aren't quite registering. And while, you know, they may not be the most contagious, if they are in close settings and they are in camp settings, they can be very contagious within a day or two. So it's not the false positives that we're going to be worried here. It's the false negatives with the rapid tests. That's why, you know, I think that can be used very well for symptomatic cases. But, you know, for the screening and for making sure that on arrival that you have the safest possible opening day, we will be very strong that PCR is the way to do that.
That's great. That was.
So I'll add to that if you guys don't mind. So yeah, so it's actually a very good, very powerful test when it's positive. There's a very, very low rate of false positives because you essentially, if you have enough virus to trigger that test, you have the virus. It's the false negatives again. And so it's questioned as a screening tool because again, PCR has this amplification step. So if someone has a very low viral load and we just get one gene copy, we amplify it to billions of copies and we catch it. Now, by identifying that patient, does that necessarily mean that patient is at a level where they're contagious? And the research is showing actually that they may not be. It may be a few more days before they can actually spread that virus. So when you're using antigen tests for screening, you have to take into consideration a bunch of different things. And you can actually add different safeguards to increase the sensitivity of the test. So for instance, in our model, we've added a PCR screening broad across every camper that comes into the test. So we've already screened out that initial set of campers with a PCR, which is the gold standard test. So we know that, hey, there's not some early sleeper, quiet spreaders in this crowd. And now all we're doing is kind of monitoring that crowd to see if we can catch somebody who's developed a viral load high enough to be contagious. And because that test comes within 10 minutes, I can remove that person from the contact pool much quicker than a PCR, which has to be sent out to the lab. So, you know, like I said, you take kind of the good with the bad with these tests. And oftentimes in my job is to find the best solution. And so I do things like repeating tests will minimize that false negative rate. It's very hard to get 2 false negatives in the same patient within 3 days. And so that gets you those higher levels of 95, 96% sensitivity that almost rivals the PCR. So I think that you save a lot of headache when you have the test at the site. And so but you do give up a little bit of the accuracy. So you kind of just got to see what, works the best for your particular situation.
Thank you. That was great. Okay. I think that was awesome. We are exactly at 3:29. So kudos to everybody. I'm very impressed everyone stayed on their time limit. So the follow-up, besides saying thank you to all 8 of the companies on today, and thank you for all attending, is that all the attendees on here and all of the ACA New York, New Jersey members will get a copy of this recording, and they will also be linked to each of the 8 companies, both their websites and the email of the main contact. So if you have any questions, you will get that within the next 48 hours. I'm working at 24 hours. And if anyone has any questions or needs introductions, feel free to email me after, and I will introduce you to the pertinent parties. Thank you all so much. Really appreciate all of you. Stay healthy, stay safe, wear a mask, get a vaccine. Bye.
Thank